Next slide, please.
Yeah, I just wanted to add to that, John. We were
Sure.
designing a creative hub for creators and entrepreneurs in Asia and other parts of the world, and we were researching what would affect their optimal creation levels. And one of the basics is have good air quality. Like if you don't have good air quality, your brain is not going to function properly. Like you need that. Like you need that to be more creative. And that is very basic. But sometimes we don't look at that. And in every, like I'm going to say, in lots of workplace design, it's terrible. Like that is terrible. And then people are supposed to perform and produce things, and they don't even have a good airflow. So sometimes you get dizzy, or you get sleepy, or you like just end up just wanting to go outside to get some air. So that is critical. What John is mentioning, it's really critical to the way we perform in our jobs. Yeah.
Last weekend, I was hiking in the nearby mountains, and I was hiking from a recently logged area where there was a lot of dust in the air and pollutants in the air, and suddenly stepped into an old growth forest where the air was just beautiful. It was just radically different, and I could just feel my whole body relaxing. I could feel my whole presence getting to a place where I could think much more clearly and think much farther into the future, and feel like where I could be in a place where I could really live and excel in an optimal way. It was just a dramatic difference. It surprised me to feel that difference from one spot to another. It was fantastic. Thank you.
And
so,
yeah, go ahead. Yeah.
No, go. Okay. So in my work there's people. What I find in working with environmental health specialists and listening to them, and 40 years experiences of working with customers in custom home projects of remodels, additions, and new construction, is that everyone's health is unique. Everyone's family's health is unique. On one hand, sometimes I'm working with amazing athletes who are completely healthy, or at least appear to be completely healthy and doing fantastic. On the other extreme, I'm working with people who have different health issues, that have asthma in the family, someone in the family, or have allergies or other respiratory issues or chemical sensitivities. At the extreme end of that area, I deal with people with multiple chemical sensitivities, people that react very badly to many different things in their environment, to the point of compromising their ability to function, both emotionally as physically as well. So this picture here is samples I did. So when I'm working with someone with multiple chemical sensitivities, I go around and collect every last caulk, paint, finish material that goes into the home, and make it into a labeled sample and a chart for them to fill out, to take to their healthcare professional to be tested to see what's acceptable and not acceptable. And with that, we go in and create a home from them that 100%, every last detail of the material and finishes and everything in that is actually done to a degree that optimizes their health rather than compromises in every way. And that is something that I've witnessed is phenomenally transformational for these people. It's just incredible, the difference in life.